Action!
Okay, so I'm going to talk about the muscles of mastication. Um, Mastication is the chewing process, and so there are four main muscles um, that are to do with mastication. That is the temporalis, the masseter, and there's two behind that, which are the lateral pterygoid and the medial pterygoids. Um, the first muscle that I'm going to talk to is in fact not a muscle of mastication. That's the buccinator muscle. That one is here. This muscle is innervated by the facial nerve and the buccal branch of that, and it originates in the alveolar process of the maxilla, the mandible, and the TMJ. And you can see that by here. Originates just from the mandible here, the maxilla here, and you can see it stretches back all the way to the TMJ. This muscle used for compressing the cheeks against the teeth and for actions such as blowing or sucking or that sort of thing. It inserts into the fibers of the orbicularis oris, which is this muscle here. I just want to reiterate that the buccinator isn't a muscle of mastication, but it does assist in mastication. Now, the next four muscles are actually muscles of mastication, and the biggest one is the temporalis, which is this one here. This originates from the temporal lines on the parietal bone, which you can see the edge of here. I just dissect this. See that this is the parietal bone, and there's actually a temporal fossa where the temporalis sits, and it originates from that temporal lines just above that fossa. If you bring back temporalis, this inserts into the coronoid process of the mandible, which you can see is here, and you can see that the lines of the muscle go upwards, and so its action is to posteriorly elevate the mandible as well as retract the mandible. This muscle is innervated by the third mandibular division of the trigeminal nerve, which is cranial nerve 5. And yeah. The next muscle is the masseter muscle. This is also innervated by the third mandibular division of the trigeminal. As you can see, it's here. And there's actually two parts. There's a superficial and a deep part. Now the superficial part, it originates from the anterior zygomatic arch. So this is the zygomatic bone. The zygomatic arch will just be about here. And so the superficial masseter originates from here, and it inserts into the lateral surface of the ramus of the mandible. If I take away the muscle itself, it just inserts over here. Now there's also a deep section of the masseter, which I don't think you can see properly in here, but that originates from the posterior zygomatic arch, just around there, just behind the anterior part. This inserts into the upper half of the ramus and also onto the coronoid process, which is here, and the upper half, which is just around here. Now its action is to posteriorly elevate and to protrude the mandible. So posteriorly elevate is to raise the mandible up and down, and protruding is the action of bringing the mandible forward. Now the next two muscles I'm going to talk about are the pterygoid muscles. There's lateral pterygoid and the medial pterygoid. Now these two are very confusing because they both actually come from the same place. They both come from the lateral pterygoid plate. However, the lateral pterygoid muscle itself, that comes from the lateral surface of that lateral pterygoid plate, and the medial pterygoid comes from the medial surface of the lateral pterygoid plate. They're both innervated by the mandibular division of the trigeminal again, and I'll just find them here. if we dissect the mandible, you'll be able to see there. So these two are the lateral pterygoid muscles. There's the superior and the inferior lateral pterygoid. The superior lateral pterygoid, that originates from the infratemporal surface of the greater wing of the sphenoid bone, which is this bone here. This is a cranial bone, and the infratemporal surface is just there. You can't see it perfectly on this, but that's the general area. This inserts into the articular disc, or the fibrous capsule of the temporomandibular joint. You can see that here. So this is the temporomandibular joint, the TMJ, and just inserts over here. Now the second lateral pterygoid is the inferior branch. Now this inferior muscle, this originates from the lateral surface of the lateral pterygoid plate. Now you can't really see this perfectly because the model isn't that brilliant, but I can show you where it does originate. If I just dissect this away, you can see that this is the lateral pterygoid plate. This is the actual lateral pterygoid plate, and the lateral surface is here, whereas the medial surface is around here. That's where the medial pterygoid actually originates from, the medial aspect of it. Yeah. So the inferior lateral pterygoid muscle, that originates from the lateral surface of the lateral pterygoid plate, which is here, and that inserts into the condylar process of the mandible. If I bring it back, you can see that's this one here. You can actually view this there. The action of these two muscles together is to protrude the mandible and to allow side-to-side movement. Now the final muscle of mastication is the medial pterygoid. This I showed you where it originates from before. It just originates from the medial surface of the lateral pterygoid, which is about here, and it inserts into the medial angle of the mandible. Now if you see, this is the angle. The medial will just be the medial aspect of the inside of the mandible around the angle. So the general rule to remember is that all four of the main muscles of mastication, which are the temporalis, masseter, lateral pterygoid, and medial pterygoid, they're all innervated by the third division, mandibular division, of the trigeminal. The assisting buccinator muscle, that is innervated by the facial nerve, the buccal branch of the facial nerve. Now these four muscles, these five muscles in fact, they all help in mastication and chewing and are important to remember. Thank you and goodbye.
Chi-Chi!